Assalamu alaikum. Hello everyone. My name is Dr.Anas Hassan. Today I'm with my big brother Dr.Tariq Hakki. He's from USA and he flew to Istanbul to meet and to do some surgeries with Dr. Bura. Yesterday we have done 2 surgeries and today we are going to do the other surgery. And today we are in Rigicon office and we are going to show you this video to present you the devices from Rigicon. So, Dr. Hakki, can you introduce yourself, please?
Yeah, first of all, assalamu alaikum. Thank you, Dr. Hassan, for having me here. Thank you to the Rigicon team. It's an honor to be here. It's an honor to work among people that are really working to innovate in the realm of healthcare, like Dr. Hassan, Dr. Bugra, and the Rigicon team. It's really working to change our devices that we're inserting in men, and also the cultural heritage and the rich history here in Istanbul. It's palpable, so we got our first hands on the Infla 10, and the pump itself is a lot smoother. I think if you look at the pump and the recoil, I mean, just for yourself, it's a lot smoother. Exactly. Then say you can feel that's a lot harder, with the other devices to hit that. The button does stick up, I'd say, a little bit higher here on some of the other devices, but this is a larger diameter button. I think that's really an intelligent. If you're trying to press a deflate button, they've really done a good job giving you a nice button to hit. Like, it's a larger diameter than, say, that button. That's a smaller button to press. It sticks up higher topographically, I think. It's up higher, but this is actually a larger target to hit. And I think that's really important. And they gave you a nice, they borrowed from one of the other companies. They gave you a nice, palpable ridge in the back, so you can kind of feel you're on the back side versus the pump, the front side of the pump. It looks like it's got 3 valves inside of it. I think that's, one of the better designs. I think one of the devices now has 4 valves, and they're having problems with that locking. I think one of the older devices has 2 valves, and they have valve override, auto inflation. I think that's really been a downside, but I think this is a nice smooth pump. It's more rounded, and I think if you're going to have a ball, it's easier to squeeze a ball than it is to squeeze more of an oblong-like deflate button, which I think is what that's more oblong-like. It's more like cylindrical, and this is more rounded. And I think as a man, deflating a pump is easier to hit a larger target, and inflating, it's easier to hit a more rounded structure that's more going to stick up, more rounded than something that's more oblong.
Okay, so patients ask about why do surgeons visit offices of the Coloplast company, Rigicon, Boston? Why do you need to visit them every now and then?
I mean, I think that's a really good question, Dr. Hassan. I think that you as an implanter, you're inserting this inside somebody's body, and you need to understand how it's put together. And it's really good to kind of partner up with industry and say, okay, here's what I'm seeing in reality, and here's what the feedback I'm getting from patients, on they like this, they don't like this, and what I'm seeing when I insert this. I think it's really important that you go back and you rehash through, hey, we like this, we don't like this, and I think that Rigicon's done a good job in innovating in a very, very stable market that has really no real honest changes since the 1990s.
So this is a good thing and a good point that they listen to experts to modify the device to make it better for the patient. So
and the surgeons, sorry to interrupt you,
and the surgeons, because you want to make your surgery easier.
Yeah, exactly.
You want to make it more comfortable for the patient, and that's why we are here. We are here to share our ideas, my experience, Dr. Hakki's experience, and trying to modify the device to be better for the patients. So a lot of our patients are interested in asking, what is the rate of inflatables versus malleables in the US?
So I think, in at least my practice, we're looking at a 95% of my practice is inflatable, with 5% being malleable. I think that the malleable implant has a role, I think, in the United States. I tend to pick a malleable device for somebody that has issues with dexterity, somebody with Parkinson's disease that really can't get a hold of that pump. Somebody that really has trouble with deflating or inflating and really has tried and can't get a hold of it. If you have somebody with Parkinson's, they have a pill roll tremor. It's really a problem. I've also found some patients that really have a buried penis. They kind of benefit from having this stuck out all the time, and I think it's easier for them to get a hold of it. So I think at least in my practice in the United States, a lot of guys are coming in and they're saying, I'd like the versatility of an inflatable. But there's definitely a role, I think, in certain populations where you have loss of finger sensation and dexterity.
So what he's trying to say is number one, or the first choice, is the inflatable, and that's what we have been trying to tell you within the last 4 or 5 years. The first choice is to get an inflatable, and the second choice in the Western society, Western medicine, is to choose the malleable. So the malleable is indicated for certain type of cases.
Yeah.
It's not the first choice, just like what happens in the Middle East. So that's why we are popularizing the inflatables, because it's the most common device in the US and in Europe. And I just going to talk with the patient's tongue. Like they're asking about, is it really going to last for like 20 years, 25 years? What is the lifespan of the inflatable?
So if you look at the data, right, you look at the data, these are going to be about 12 years, right? You're going to be looking at about 12 years worth of data, because the tubing, so the problem with the inflatable device is your weak spot is this tubing, right? The weakest spot here is the tubing that is going to be in there, and usually they're going to get about 12 to 15 years. If you tell somebody you're going to get 12 years out of the device, you set their expectations, and it's realistic. If they live beyond that, so be it, but that's, what the life expectancy of the device is. I think there's warranties with each company. I think Rigicon's is lifetime.
Yeah.
But the question is why wouldn't you use an inflatable? This is more like a natural penis. You don't have to worry about, this is always pressing, right? And the risk that you have, with somebody with wheelchair and the spinal injury, you already have the data saying that they'll do worse with a malleable.
Yes.
I mean, because they're going to have a higher risk of erosion. They can't feel their body from the waist down, so they'll have catheters in. Risk of erosion is higher.
Risk of infection.
They're going to have issues with this being in. While it's convenient, it's nowhere near the girth. So whenever you size a malleable implant, you're not giving the guy his length or upsizing him, because you're worried it's going to poke through.
True.
So whenever you put an inflatable, you can say, hey, let me give you exactly what you measured, and maybe you'll gain length as you get and gain girth as you live with the device. So after you put an inflatable device in, it's dynamic, right? It's not static. This is a static girth, right? It's going to be a fixed 13 millimeters.
True.
His dick ain't getting any fatter. It's over. There is no girth to be gained. The length of the device, you shortened it, right? I tell every guy, hey, I'm going to measure you a certain amount. I'm going to cut a little bit off, so I'm going to get the pressure off, because otherwise this is pushing and pushing, and it can push through. And some patients, they'll leave it in a position, they won't move it, like, oh, it's sore, because they're numb, they can't feel. So, patients with the inflatable, they will do better with girth and length expansion over time, because you get this pseudo capsule that forms around the device.
True.
Malleable, inflatable, you're going to get a pseudo capsule.
Yeah.
And what happens is over time, that thins and stretches. So wait a second. You're telling me that no matter what device you're going to put in, they may want an upgrade. So let's not talk about a penis. Let's talk about breast implants. Let's say you get a breast implant. Usually about every 15 years, the girl's going to want an upgrade, because she's going to notice it's sagging. Why? Same concept. The pseudocapsule around the device will thin and stretch. So if you give a patient an implant and you size them aggressively and you put this in, they will grow into their device, and their penis will get fatter with time. So I tell patients, hey, cycle the device, wake it up. If you do a hip surgery, they walk you now in the US the day of your hip. We now cycle these devices quickly after surgery, because we're trying to wake the penis back up again.
Yeah.
It's supposed to be becoming erect and changing. It's dynamic. which is has more biomimicry, right? Your penis isn't always hard all the time, stuck in one direction, right? It's soft and then hard when you need it to be. And the social awkwardness of having to bend your penis down, or you can't bend this down, that can be a problem, I would think. I mean, I don't know what you experience in Iraq, but I think that would be a problem.
Yeah. And another question from the patients: what happened if the device, the inflatable, broke inside of me?
I mean, I think, if the guy's 95 years old and he's not using it, I would say, okay, just live with the device broken. You can't have sex anymore, but that's fine. But I think if it's under warranty, then the guy's device is covered, and all you have to do is just change just for a new device.
Because it's called the hydraulics, so they think that there's an oil mechanism of, but this is normal saline. This is only normal saline. If it leaks inside your body, no problem with that. It will not cause. It's not toxic.
It's not toxic. Yeah, the saline is essentially salty water. So if this was to burst or to leak out, it's just like you drank a cup of water.
It will be reabsorbed or absorbed inside your body, and it will not cause you any problem.
Yeah.
And you can change it on elective basis. No emergency. No need to rush.
Exactly.
Get your guarantee, get your warranty, whatever, and then you can change the device. Maybe it will be longer and girthier.
But I warn you against something. And this is something where I think Dr. Hassan is too humble. If you put an implant in, it's an easy surgery for the surgeon. If you do a revision, it's easy for the patient, but it's hard on the surgeon. So you've got to find somebody that does this surgery and does the revision surgery regularly and knows what they're doing. Mm-hmm. I think that's the danger. And Dr. Hassan does a lot of these surgeries. He's a high volume implanter. So when you come see him, this man has seen this surgery, he's put this in, he's revised it, and so you know what can get stuck and scar tissue from the surgery. So the revisions take a little bit longer, right? So if your virgin case taking you 30 minutes, the revision maybe takes you an hour. So it takes us a little bit longer because you've got to take everything out and put everything back in again.
Mm-hmm. So the last question is, when are you coming to visit us in Iraq, Baghdad? Because they heard a lot about you and they want to see you in Baghdad.
No, you need to come. You guys, it's the homeland, right? It's back home.
Yeah.
So inshallah, I'd love to come and hang out with Dr. Hassan here.
We do
get some masgouf, get some kebabs, and put some implants in, and hang out in the old city.
Yeah, we'd love to. We'd love to see him. I'm going to see him next week in Texas in the SMSNA.
Inshallah.
Thank you for being with us on this video.
No, thank you for having us.
Thank you, brother.
Thank you.